Hi, my name's Melissa and I work in human resources at Baptist DeSoto. I gave birth to my daughter in March of 2021. My husband also works in healthcare, and together we decided to get the COVID vaccine. I want to start by saying that I can empathize with new moms who are struggling with the decision to get vaccinated. We have to weigh the costs of contracting COVID with the unknowns of introducing a new vaccine into our body and potentially that of our newborn child. There are three things that helped me make this decision. First, data. Back in December 2020, when Pfizer and Moderna submitted for emergency use authorization through the FDA, I wanted to go to the source. I wanted to see for myself the graphs, the numbers that gave medical professionals the confidence to authorize these vaccines. So I read a lot of clinical trial data sets for both vaccines. I learned over 70,000 people participated in these vaccine trials combined. I learned that trial participants developed significant immunity even upon receiving the first dose, and their immune response only strengthened after the second dose. Most importantly, I learned all participants in these trials avoided severe cases of COVID-19. So I knew these vaccines worked, but they hadn't been studied in pregnant women yet. So my next step was to find a source of assurance. I trust my OBGYN, and I asked her about the safety of vaccines for women like me. She shared that mRNA vaccines, like the Pfizer and Moderna vaccines, have been in development since the SARS virus came about in the early 2000s. This means there has been nearly 2 decades of research backing this technology, and the pandemic gave us the opportunity to put this remarkable science to use. Then she explained how our cells take the vaccine's mRNA segments and enable our immune system to create protective antibodies. The mRNA segments themselves stay in the body only a short period of time after injection, and then the antibodies remain to fight the virus if we ever were to encounter it again. This alleviated my fear of passing anything adverse on to my child. The last thing that convinced me to get vaccinated was the potential my vaccination could have to improve my future for my daughter, my family, and my community. Getting vaccinated means I am significantly less likely to contract a severe case of COVID and more likely to be fully present to care for my newborn baby. I'm also breastfeeding my baby, and when I took the vaccine, I didn't notice any drop in my supply nor any adverse effects in my daughter. After my second dose, I had about 24 hours of feeling tired, but I knew the vaccine was working. And while the verdict is still out about whether COVID antibodies pass to a baby via breast milk, I'm hopeful I'm at least giving my daughter some level of protection from COVID through my breast milk, or at the very least, surrounding her with vaccinated family and friends who are less likely to contract the virus and pass it along to her. Above all, getting vaccinated has given me hope that we can beat this virus and go back to our normal lives. I'm not clinical myself, but I'm married to a healthcare professional, and I've been working alongside healthcare professionals like you every day who are struggling to remember the passion you have to serve others when our healthcare system is so inundated with people who are so sick. Getting vaccinated has given me a sense of relief, backed by data, assurance, and potential that we can and will return to normal because we will beat this virus. And once I knew this decision was right for me and for my family to get vaccinated, I knew I was doing my part to assure that my daughter and other children like her have the potential one day to escape the stress and the fear of this pandemic. If you're on the fence about getting vaccinated, I'd encourage you to find accurate data and assurance from medical professionals you trust to make an informed decision. Thanks for listening.